Petsadena. Let's talk about ear infections. Ear infections are one of the most common ailments that we see pets for, both dogs and cats, year-round. Ear infections are typically painful, they're messy, and really a nuisance because they tend to come back over and over again if we don't find the root cause. Ear infections have multiple causes, and typically getting to the root cause is the way to treat it and to prevent it from happening in the future. One cause for ear infections is getting dirt, debris into the ears. Doggies who have ears that are upright tend to get more debris inside the ear canal, or doggies who are outdoors more in areas that have a lot of dirt and debris in the environment. Doggies who have ears that are floppy can trap moisture in their ear canals, leading to an ear infection. Another cause for ear infections includes getting water in the ear canals and not drying it out. So doggies who like to go swimming a lot in the pool or at the beach and don't get their ears cleaned thoroughly and dried can get ear infections. Doggies who are getting baths and we're not cleaning the ears and drying them after a bath can also end up with ear infections. So it's very important to look into some of those causes when we're looking at a primary cause for ear infection. Another common cause for ear infections in dogs is actually allergies, and probably one of the more common causes that we see. By allergies, I mean allergies that can cause inflammation in the ear canals, and sometimes there are allergies that can cause inflammation in the rest of the body as well. That then leads to overgrowth of bacteria and yeast in the ear canals that can then manifest as an ear infection. Ear infections present themselves in different ways. Whether it's your pet is scratching at their ears more, your pet is shaking their head, your pet is potentially crying in pain. Ear infections are also very smelling, typically because of the bacteria and yeast producing that odor. Another sign of an ear infection could include redness on the outside of the ear canal or even crusting scabs around the ears. When a pet presents for a possible ear infection, your veterinarian will typically recommend to perform what's called an ear cytology. That's where they'll take a sample of the debris in the ear canal. They'll put that on a slide, look at it microscopically to identify if there truly is an infection, and if so, what type of infection we're dealing with. Yeast and bacteria are the most common organisms that we isolate from the ear canal when there's an infection. Now, those yeast and bacteria normally live in the ear canal. However, when there's inflammation or there's the right environment, maybe with moisture, if the ears are wet and dirty, that will lead to bacteria and yeast overgrowth. And we're able to identify that with our ear cytology. The ear cytology is also important to identify which type of medication is best to treat the ear infection. So depending on the results, your doctor may recommend a specific type of eardrop that either you apply directly in the ear canal yourself at home multiple times a day, or ear medication we can apply at the hospital that will release itself slowly over several days to weeks. Now that we've diagnosed an ear infection, how do we treat that? We talked about how medication is going to be prescribed or administered. Another important component on treating ear infections is to clean the ears thoroughly. So your veterinarian is going to want to recommend to perform a thorough ear cleaning or even an ear flush in the hospital. That usually consists of getting an ear clean solution that's antibacterial and anti-yeast and washing the ears, removing all the debris out of the ear canals so that the medication can penetrate the skin in the ear canal much more thoroughly and be more effective. Additionally, if there's a lot of debris in the ears, we may have to flush them under a heavy sedation or even anesthesia if it's a chronic ear infection. Once we've diagnosed and started treatment for an ear infection, now we want to prevent it in the future. There are a few different ways we can try to prevent these ear infections. First, as I mentioned, we want to find the root cause. If there is dirt and debris that's getting in the ear canal, is there an environment your pet's going into that we could potentially avoid? Or maybe make sure we clean their ears after they're in that environment. If your pet is getting, in the pool and swimming frequently or getting baths frequently, we want to make sure that we're drying those ears thoroughly after those activities. Now, the last thing is if we think there could be allergies. For more information on allergies, please see my allergies video. Briefly, I can say there's 3 types of allergies, and 2 of them, food and environmental allergies, are the most common for potentially leading to recurrent ear infections. So we would want to discuss how we get to the bottom of possible allergies with your veterinarian so that we can prevent ear infections in the future. One of the most important things that you can do to help maintain your pet's ears and prevent ear infections is to perform ear cleanings at home. Please take a look at our video on ear cleaning, as it's done a specific way to be thorough and ensure that you do it safely for your pet. The last thing we'll do is discuss follow-up care. Follow-up care consists of a progress exam where you return to your veterinarian, usually after 2 weeks of treatment, to ensure that the ear infection has resolved. Your veterinarian will not only look at the ear canal, make sure it looks healthier, the infection looks like it's physically gone, but also get another sample from the ear to make sure microscopically the infection is gone. It is important that we confirm the infection is gone so that we don't have frequent recurrence of the ear infection or maybe persistent ear infections that might seem better physically, but microscopically we haven't fully treated the infection. If you have more questions about ear infections, make sure you ask your veterinarian at your consultation.